I'm going to talk to you today a little about the female reproductive tract. When we talk about the female reproductive tract, we have four parts, which is the uterus, the vagina, the tubes, and the ovaries. The uterus is a midline structure which lies in the pelvis, and the uterus itself is made up of three parts: the fundus, the body, and the cervix. The cervix opens into the vagina. So when a couple has intercourse, the sperm that is deposited in the vagina can come into the uterus through the cervix, and then it goes into the tubes. The tubes are two structures on either side of the uterus which make contact with the ovaries. The ovaries again lie on either side of the uterus, attached to it by the ovarian ligaments, and the tubes and the ovaries are supposed to make contact with each other so that every month when an egg is released from the ovary, the tube can pick up the egg and the egg waits in the tube for the sperm to come and fertilize it. When the egg is fertilized by the sperm and an embryo is formed, this embryo then moves back through the tube into the uterine cavity, where usually it gets implanted around the fundus, and if implantation is successful, a pregnancy occurs. So for a normal pregnancy to occur, it's extremely important that the female reproductive tract is intact and functioning properly. We need to have ovaries that have eggs and produce eggs. The tubes need to be open. The uterus needs to be normal with no deformities, no septums, no synechiae, and the vagina has to be normal as well.